Hello dear viewers, after a long back, welcome to Vision Pharmacy. In this video, we are going to study what is meant by therapeutic incompatibilities. So before we start with our today's video, please do like, share and subscribe my YouTube channel as well as do not forget to hit bell icon for getting updates on upcoming videos. So let's begin. Starting with the definition of therapeutic incompatibility. So therapeutic incompatibility are unintentional pharmacodynamic or pharmacokinetic interaction that takes place in vivo after administration of medicinal product. Or therapeutic incompatibility may be result of prescribing certain drugs to a patient with the intention to produce a specific degree of pharmacological action, but the nature or intensity of the action produced is different from that intended by the prescriber. यानी जो भी मेडिसिन दिया गया है वो मेडिसिन कुछ और थेरेप्यूटिक एक्टिविटी प्रोड्यूस करने के लिए दिया गया है, लेकिन जब वो मेडिसिन लिया गया है बाय द पेशेंट एट दैट टाइम जो एक्टिविटी प्रोड्यूस हुआ है वो एक्टिविटी जो एक्सपेक्टेड था उससे अलग है. सो दैट इज़ कॉल्ड एज थेरेप्यूटिक इनकम्पैटिबिलिटी. मतलब इन सिंपल टर्म्स इट मीन्स अल्टरिंग द थेरेप्यूटिक इफेक्ट ऑफ ड्रग by administering it concurrently with other. Drug interactions are interactions between drug. So basically जब कोई भी दो ड्रग साथ में दिए गए हैं तो फिर उनका जो इफ़ेक्ट मिलना चाहिए वो इफ़ेक्ट नहीं मिला है, उसके अलावा कुछ अलग इफ़ेक्ट मिला है, उसे हम कहते हैं थेरेप्यूटिक इनकम्पैटिबिलिटी. नाउ मूविंग फर्दर. So basically different kinds of drug interaction can be, so mainly there are of two types. First one that is pharmacodynamic interaction और second है pharmacokinetic interaction. इसके अलावा जो अलग interactions हैं वो है drug drug interaction, drug excipient interaction, excipient interaction, drug and food interaction and excipient packaging interactions. So these are the different interactions that may result into therapeutic incompatibility. Now let us see all these interactions one by one. So we'll be starting with the very important, that is the pharmacodynamic interactions and kinetic interactions. So basically dynamics होता क्या है? तो as such pharmacodynamics is what the drug does to the body. यानी ड्रग लेने के बाद वो हमारे बॉडी के साथ जो भी करता है उसे हम फार्माकोडायनामिक्स में स्टडी करते हैं. It is related to the pharmacological activity of interacting drug. That is, in simple words, जब भी हम कोई दो ड्रग साथ में ले रहे हैं तो फिर वो ड्रग हमारे बॉडी के साथ क्या कर रहा है, what that drug is doing with our body. ठीक है, whether the drugs are producing synergism, that is they are helping to give a more better result, or they are interfering with activity of one another, एक दूसरे के एक्टिविटी होने से प्रिवेंट कर रहे हैं, दैट इज़ एंटागोनिज्म, या फिर रिसेप्टर साइट पे बाइंड होने में अफेक्ट कर रहे हैं, एक्सेट्रा. सो दैट इज़ कॉल्ड एज फार्माकोडायनामिक्स. वेर एज फार्माकोकाइनेटिक इंटरेक्शन मतलब होता है वॉट फार्माकोकाइनेटिक का मतलब ही है वॉट ड्रग डस विद आवर बॉडी. ओके, सॉरी, वॉट बॉडी डस विद द ड्रग. यानी जब हम ड्रग लेते हैं तो हमारा बॉडी ड्रग को किस तरह से रिस्पॉन्ड करता है. फॉर एग्जांपल ड्रग लेने के बाद वो ड्रग का एब्सॉर्प्शन होता है, डिस्ट्रीब्यूशन होता है, मेटाबॉलिज्म होता है, एक्सक्रीशन होता है, राइट. मतलब ये सारी एक्टिविटी हमारी बॉडी करती है ड्रग के साथ, तो इसे हम बोलते हैं फार्माकोकाइनेटिक्स. ओके, सो फार्माकोडायनामिक मीन्स व्हाट ड्रग डस विद आवर बॉडी. ड्रग हमारे बॉडी के साथ क्या कर रहा है, ठीक है. तो जब हम दो ड्रग साथ में लिए तो फिर वो एक तो एडिटिव इफेक्ट दे रहा है, सिनर्जिज्म इफेक्ट दे रहा है, एंटागोनिज्म इफेक्ट दे रहा है, एक्सेट्रा. वेर एज फार्माकोकाइनेटिक मतलब व्हाट आवर बॉडी इज डूइंग विद द ड्रग, दैट इज उसका एब्सॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म, एक्सक्रीशन, एक्सेट्रा. गेटिंग. नाउ मूविंग टू फर्दर इंटरैक्शंस. ड्रग ड्रग इंटरैक्शन, दैट इज it occurs when a drug interact or interferes with another drug. This can alter the way of one or both the drugs act in the body or cause unexpected side effect. This action can be synergistic, yani they may effect of individual drug may be increased, or antagonistic, that is the effect may be decreased or a new effect can be produced. मतलब ड्रग ड्रग इंटरेक्शन जब भी हम दो ड्रग साथ में लेते हैं तो फिर कोई अनएक्सपेक्टेड रिजल्ट सामने आ सकता है, ठीक है। वो दोनों ड्रग एक दूसरे का जो भी इफ़ेक्ट है वो इंक्रीज़ कर सकते हैं, डिक्रीज़ कर सकते हैं, या फिर कोई नया इफ़ेक्ट प्रोड्यूस कर सकते हैं। फॉर एग्जांपल, कोडीन विद पैरास्टामोल इंक्रीजेस इट्स एनाल्जेसिक इफेक्ट। सो ये तो हो गया ड्रग ड्रग इंटरेक्शन। नाउ मूविंग फर्दर टू द नेक्स्ट वन, दैट इज़ the next type of interaction is drug excipients interaction. Now students, you know, while formulating any dosage form along with active pharmaceuticals we also need excipients, right? तो हमें एक्टिव ड्रग के साथ में एक्सिपिएंट्स की भी ज़रूरत होती है, और कई बार ये एक्सिपिएंट्स जो ड्रग है उसके साथ रिएक्ट कर देते हैं। ओके, सो बेसिकली व्हेन वी स्टडी आइडियल प्रॉपर्टीज ऑफ एक्सिपिएंट्स, so the most important parameter for excipients is they should be inert, that is they should not implement their own therapeutic effect. However, if paracetamol, we are talking about the example, so paracetamol reacts with lactose जो diluent यानी बल्क फॉर्म करने के लिए यूज़ करते हैं हमारे फॉर्मुलेशन में. So when paracetamol can react with lactose as that is a diluent in the presence of magnesium stearate to form brown color compound, and this may darken the tablets. So this is the example of drug excipient interaction, यानी ड्रग का और एक्सिपिएंट्स का इंटरेक्शन हो रहा है, ओके, विच इज़ रिजल्टिंग इनटू formation of a dark tablets. Then moving to next one, that is excipient interaction. Okay, so other than active pharmaceutical ingredient, we need to incorporate n number of excipients in order to come with our product, right? So this type of interaction occurs when two or more excipients react in a drug molecule, right? When they react, okay. So for example, addition of electrolytes such as Ca++ or Mg++ ions in suspension containing sodium carboxymethyl cellulose will lead to formation of calcium or magnesium CMC, and the suspending agent will be destroyed and it cannot perform its function. That is, here these excipients have reacted together, resulting into dysfunctioning of suspending agent. Getting? So here this is the example of excipient interaction. Now moving to the next one, that is drug food interaction. A drug food interaction happens when food we eat affects the ingredients in a medicine we are taking, so the medicine cannot work in proper way. So आपको पता है बहुत सारे मेडिसिन होते हैं, those we need to take before food. Medicines that may cause irritation are to be taken after food, right? So our food, they affect drug, right? So here is the example, that is blood thinning drugs such as warfarin interfere with vitamin K dependent clotting factor. So eating too much green leafy vegetables, which results in high vitamin K, can decrease the ability of blood thinners to prevent clotting. Okay, so this is the example for drug food interaction. Now moving to next one, excipient packaging material interaction. So basically students, in some pharmaceutical formulations our excipients and packaging materials may interfere with each other, right? And this can cause excipient packaging interaction. We have already seen that if many times if you have used a plastic container, then it may absorb preservative from your product, or sometimes your plastic or glass containers which may consist of alkali material, that may be leached into the product that have been stored therein, right? So therefore these are the examples of excipient and packaging material interaction. Okay, now moving to the next slide. So these therapeutic incompatibilities occurs due to following reasons. So now we have seen various kinds of interactions that may lead to incompatibilities, and now we are seeing the various reasons. So the first one is error in dose, wrong drug or dosage form. Third one is contraindicated drugs. Next is synergistic and antagonistic drugs, drug interaction, and prescribing drug with wrong direction. So these are some of the causes which lead to therapeutic incompatibility. Moving to the first one, that is error in dose. So talking about error in dosage, many therapeutic incompatibilities results from error in writing or interpreting the prescription order. For example, if you see the prescription that is written to the right hand side, that is Rx, where codeine phosphate the physician has mentioned 0.5 gram, prepare 10 powder, direction 1 powder to be taken at bedtime. However, this will lead to overdose, right? So actually the physician was intended, or he was willing to write 5 mg. However, he have written 0.5 gram, which means 500 mg. So in such case, a prescription should be referred back to the prescriber, that is the physician, in order to rectify the dose of the drug, right? So obviously this is a very serious type of dosage error, and care has to be taken by the pharmacist while dispensing so that this error in dosage can be avoided by the pharmacist. Okay, now moving to the next one, that is wrong dose or dosage form. So there are certain drugs which have quite similar names, and there is always a danger of dispensing a wrong drug. For example, prednisone and prednisolone, और डिगॉक्सिन एंड डिकटॉक्सिन, राइट? तो अगर हम इनके प्रोनाउंसिएशन सुनते हैं तो काफ़ी हद तक ये हमको एक जैसे ही लगते हैं, बट दिस ड्रग्स आर डिफरेंट, राइट? सो ऑलवेज केयर हैज़ टू बी टेकन that we are giving the right drug. Getting? So sometimes many drugs are available in different dosage forms, and hence if the dosage form is not clearly mentioned on the prescription, it becomes necessary to seek clarification from the prescriber. Getting? So फिलहाल मार्केट में एक ही ड्रग के बहुत सारे डोसेज फॉर्म हैं. वी हैव द टैबलेट्स, वी हैव देयर लिक्विड डोसेज फॉर्म्स, वी हैव some other types of dosage form, right? So what to be dispensed, so that has to be clearly specified. तो अगर आप देखो तो टैबलेट के पहले फिजिशियंस दे राइट डाउन TAB, राइट? कैप्सूल, सस्पेंशन, सिरप, so they write the initial alphabets in beginning. So if it has not been mentioned, so it becomes your responsibility to contact them and ask that what type of dosage form is to be given to the patient. Then the responsibility of the pharmacist becomes to check the prescription intensively, and if he finds these type of errors, he should immediately consult the prescriber for the clarification. Getting? So in case if you find anything error in the prescription, then, or if you are not getting what has been prescribed, what dosage form is to be given, then you are supposed to contact the physician immediately. Okay, now moving further to the next one, that is prescription containing contra-indicated drugs. Contra-indicated अगर मैं आपको सिंपल वर्ड्स में बताऊं तो दैट मीन्स नॉट फिट या फिर नॉट प्रॉपर और सेफ. गेटिंग? So these are certain drugs which may be contraindicated in a particular disease or a particular patient who is allergic to it. For example, if corticosteroids are contraindicated in patients having peptic ulcers, अगर आप peptic ulcers के patient को corticosteroids दे रहे हो तो obviously that is going to give some adverse effect. Okay. Second example, The penicillin and sulfur drugs are contraindicated in the patients who are allergic, or barbiturates and morphine should not be given to asthmatic patients. Therefore, before prescribing such substance, a doctor must be careful. If he does not, a pharmacist should show his caliber to point out such type of doctor's error, and such errors must immediately be referred back to considered doctor and get corrected. So whosoever is a concerned doctor, if you find such contraindications in the prescription or in the drugs that are being prescribed, which may be not safe for the patient, you are supposed to refer back to the physician and get the prescription corrected. Okay. Now, moving to next one, that is prescribing synergistic or antagonistic drugs. So students, when two drugs are prescribed together and they tend to increase the activity of each other, they are called as that is called as synergism. We have already studied this. And when two drugs that are prescribed together, they tend to decrease the activity of each other, that is called as antagonism. For example, a combination of aspirin and paracetamol increases the analgesic activity, that is synergism, right? A combination of penicillin and streptomycin increases antibacterial activity. यहाँ पे भी हमें synergism effect मिल रहा है. Whereas when amphetamines are given with barbiturates, they will show antagonism effect. Getting? So thus the prescription is referred back to the prescriber for necessary corrections. So obviously a pharmacist should have sufficient knowledge to check that whether they are going to give a synergistic effect or antagonistic effect, and likewise they should consult the physician when and where they feel necessary. Okay. Now moving to next one, drug interactions. So already we have seen the various interactions, right? We have seen drug food interactions, drug interaction, drug excipient interaction, excipient interactions, right? Now in drug interaction, the effect of one drug is altered by prior or simultaneous administration of other drug. The drug interaction can usually be corrected by proper adjustment of dose if the suspected interaction is detected, right? जो भी interaction हो रहा है उसका अगर हमें cause पता चल रहा है तो फिर we can be able to rectify these interactions. For example, now here the physician have mentioned tetracycline capsule 250 mg. Okay. Direction दिया हुआ है, take one capsule every 6 hours with milk. However, tetracycline is inactivated by calcium that is present in milk. So these tetracycline capsules should not be taken with milk. Thus, in the prescription, the therapeutic incompatibility is unintentional. ये जो एरर हुआ है बाय फिजिशियन, वो जानबूझ के नहीं हुआ है, वो अनजाने में हुआ है, राइट? इफ़ दिस टेट्रासाइक्लिन इज टेकन विथ मिल्क तो ऑब्वियसली हमको इफेक्ट नहीं मिलने वाला है. तो देयरफॉर द प्रिस्क्रिप्शन शुड बी रेफर्ड बैक टू द प्रिस्क्राइबर फॉर द नेसेसरी करेक्शन. एंड the direction that has been mentioned by the physician, that is take one capsule every 6 hours with milk, that needs to be changed. वहाँ पे वो मिल्क की ज़रूरत नहीं है, वो मिल्क हटा के it can be mentioned as water, right? So here we have seen different types of therapeutic incompatibilities as well as their various reasons why these therapeutic incompatibilities are caused and the various way how we can rectify. So thank you for watching till end. Thank you.